everyone. My name is Crystal Hill-Davidson, and I decided to do my final project on strokes. And I decided to do strokes because I had several family members that suffered from the disease, and so I wanted to learn more about it and research it. So just to give a little bit of breakdown, so a stroke, in case a lot of you don't know what that is a cerebrovascular accident, and it occurs when blood flow to an area of the brain is cut off. Because there is no oxygen to the brain cells, they die. So just to give a breakdown of the ancient history, I go into some of the pioneers of medicine that studied the disease, and one of the most famous scholars that has been a great influence on the progress of medicine is Avicenna. He's considered as a pioneer of neurology and cardiology. He was only 16 years old when he became a physician, and he is also well versed in astronomy and philosophy. Philosophy, excuse me. He has written over 400 books, and one of his most popular is the Canon of Medicine, which is a doctrine that has been used by a lot of researchers and physicians after him. Um, just to give more information on my paper, I just kind of go into the Middle Ages and their theories and how they determined the causes and the symptoms of stroke. Um, Also, I'm going to skip forward to the 1950s. And in the 1950s, there was the death rate for strokes was 4 times what it is today due to the fact of little or no knowledge of the disease. In the 1960s, the mortality rate kind of decreases due to the fact that hypertension and smoking was found to be contributing factors to the disease. So the advancement and the knowledge of the disease had kind of increased at that time. By the 1970s, the decline in the mortality rate um, due to stroke was even greater because of you had computer, no, not computer, um, the computer tomography because it was used as early detection, and then also you had PET scans that were done to test the brain metabolism, as well as aspirin was used as prevention. In 1995 is when the National Institute of Health funded a clinical trial for the treatment of ischemic stroke. The Food Drug Administration approved the medication that breaks up the blood clots that cause ischemic strokes, um, which is still used today, and it's called tissue plasminogen activator, or TPA. And TPA is administered within 3 hours of an ischemic stroke. It maximizes the patient's recovery and reduces the risk of disability. Like whenever a person has a stroke, sometimes there's paralysis, speech impairment that occurs. So this helps with that. Um, and so today that is still being used. There are still trials going on to better um, treat the disease, but right now TPA is one of the most effective. A lot of the culture that's most affected by strokes is African American women, due to the fact of the genetic disorders, sickle cell anemia, and then there's also high blood pressure. And then there's also obesity and diabetes that contributes to stroke as well as in African American women. So it's important for African American women to have a healthy lifestyle, uh, have a good diet, and also to go and see the physician on a regular basis. But that kind of in a nutshell is my paper. Thank you and have a good night.